So I just want to welcome you to the Always Andy's Mom podcast. We're doing a little kind of follow-up episode today that I've never done before, but it's a little bit of a bonus. Just talking about Bryson. We had a great episode with Bryson's mom a few weeks ago now, and you called him B, and he called you Dr. B. So we heard quite a bit about you. And then what was really so touching to me was when she read the letter that your dad wrote to you after Bryson passed away. So I just thought, I think it would be neat to hear from you and just hear your perspective a little bit.
Yeah, I always tell my residents and medical students that who you are as a doctor will be shaped by years of training and textbooks and things, but who you are as a person and a doctor will be shaped by like 10 patients, and you carry them with you. Bryson was one of those that I carry with me, along with so many of our other kids that just they need extra time, attention. They just need some help in the hospital. And I remember, it was kind of weird hearing an email that my dad wrote from like 7 years ago, but or some time ago. But I think that just speaks to the fact that these kids have an impact on people, and especially people who are not, like my dad's not in the medical field. So it's the only patient of mine that he's ever met. And I think it stuck with him and my mom, I think, just to have a glimpse, because the walls of a children's hospital are sort of a special place and not a lot of people see inside of them. Mm-hmm. And so I think just having a glimpse of kind of what that world is like gives people an appreciation for how strong these kids are and how strong the families are.
Mm-hmm. Well, and it's just nice. I loved hearing that and reading that letter, just because as bereaved parents, we so feel like our kids are going to be forgotten and we're the only ones that will remember them. And to read that and the impact that he clearly had on you and that he had on your parents who met him, like you said, one time, and that impacted them. And so it's just amazing, I think, for parents to know that our kids mattered to more than just us,
Yeah. And Bryson was an amazing little boy, and Amanda was amazing as well, and probably stronger than I ever would have been in that situation. But there are so many of these kids. It's not just one, and our hospitals are sort of filling up with them as medicine gets better, but not good enough to be able to keep up with them. They're smarter than the textbooks are. And so I always think about these kids as, it's more art than science. You tweak things and you see what happens. You tweak things and you see what happens. And, they're helping us push the boundaries of medicine. And we always carry that with us. So, you can think back to, I'm sure you can too, patient experiences that you've had. And we are so ridiculously lucky that we're allowed to participate in this. And I think about, I've always been a hospitalist. So I've always been in the inpatient setting, and you'll walk in and there are parents in their pajamas, and there are parents fighting, and there are parents, you're walking into their world, and all of a sudden you are exposed to who they are as people, who they are as a family, their family dynamics. You go from a complete stranger, and then you open the door and you become, for that period of time, for better, for worse, whether they want you to or not, part of their family dynamic. Mm-hmm. And it's just so important that we see that for what it is, rather than, take it for granted.
Mm-hmm. You're 100% right that you do become part of it, their family. And it's funny for me, I really noticed that so much actually after my own son died, because these families they felt so badly for me, because I'm like a little part of their family, the ones that I've taken care of their whole lives. Cause now I'm a general pediatrician. So I'm just the one. I'm the one that they go to, the one that they get advice from, the one that they've been taking their kids for 5, 10, 15 years. And when they saw this horribleness happen to me, they took it personally too, So I felt like they just included me as part of their family. So when I had a significant loss, they felt it in a way that I didn't actually expect them to, because I didn't kind of realize how much they felt like I was kind of part of their family until
Yeah.
that happened. So it was an interesting way to be. But you're right. You said earlier, before we even started recording, that what a piece of advice that you give to residents and medical students. Why don't you share that with the audience again? Because I thought that was really key.
Yeah. Just to basically just to carry these kids with you. Like,
Mhm.
let them affect you. Let them become part of who you are and shape who you are. And it's so easy right now in medicine right now, between just the sheer volumes of documentation and electronic records and my charts and malpractice, and it's so easy to forget why we got into this in the first place.
Mhm.
And you can go into these situations if you're having a bad day or you're already behind. You can go into a door, you can knock on a door, walk in and walk out in 5 minutes and not have actually done anything except check the box on your list of things to do. And I do try to tell people, and I'm not always perfect at this either, but I try um, to provide something to that family, whether they are in a good mood or a bad mood, whether you can do anything medically or not. Because for Bryson, there were most days, I would say the vast majority of days for Bryson, I couldn't do anything for him. And his mom knew that, and I would walk in and I would say, how's he feeling today? And she'd say, yeah, he's still got this abdominal pain, or he's still got this kind of lethargy. And I'm like, yeah, I hope it gets better. Because there's
Yeah.
nothing medically I can do,
Hmm.
but I can show them that I care, that
Yeah.
I recognize that he's in some kind of pain or discomfort, and I can show a family that somebody's here for them. And even though we don't have the answers, you hear from these families, and I'm talking a lot about kind of these complex kids, although
Hmm.
obviously we take care of everybody, but you hear from these families so often that what they really want is just, and I have 2 kids as well, you just want to know that the person is trying, that
Hmm.
they're not seeing you as just another door that they have to walk into. And so I think that to me is the most important thing we can do is show them that even if we can't fix them, we genuinely care about what they're going through, and we'll do anything we can to help them.
Hmm. I know that Amanda said that when you would walk in the room, Bryson's face would light up. He'd say, Dr. B, because he was always so excited to see you. So even if you felt like you weren't doing anything for him emotionally, you did something for him about every time you walked through the door, I think.
Oh,
So
see, I
that's nice.
remember him yelling at me to get out more often than not. I do remember he had this like little Nerf gun or something that he would like shoot at you when you walked
Ah,
in. I had another patient at the same time who used to put I hate snakes. And she would put this like rubber snake on the top of her door. So when I would open the door, it would like follow me. There was a whole group of patients around that time on that floor. And it was a very formative time for me as a physician. I was only a couple years out of residency at that point. I was still kind of trying to learn who I was as a doctor. And those patients certainly helped shape me.
well, and I think too, in our training, they don't do a very good job with that at all, with having the personal side of medicine. I think it's horrible, actually. So I've spoken to one medical school class so far. I hope to be able to continue to do that a little bit. But I know the feedback I got was so nice, because so many of they're third-year medical students, and they were really feeling very disillusioned. Like, they really went into medicine to help people. And now they were in the midst of it, which it's just studying and books and this and that. And it's not about the people and about the patients. And that's scary to them. And it was nice I know they were very appreciative to hear from me, to feel like they didn't have to lose their humanity, because they were really feeling pressured to almost lose that part of themselves to become a physician. No?
Yeah. Sometimes the best part of my year. So right now I'm at Johns Hopkins. Before this was the University of Rochester, and I do, just like all faculty at medical schools, we do the interviews with like the new incoming med students, and like when they're applying, and or when they're applying for residency. And the best times of the year sometimes are just those conversations with people who haven't been beaten down by the system yet, who still have that, I'm getting into this because I want to help people. And it's so easy in healthcare right now to lose that. You really have to force yourself. And I've had periods in my career where I've lost that, and lost a sense of what it was I'm really here for, and just kind of in here trying to get to the next patient, the next patient, the next patient. And so it's really hard to make sure that that's something that you're paying attention to.
Mm-hmm. Well, but so key, I think. I mean, it just so important. I feel like as time goes on, I don't know. For me, obviously things have changed a lot, because after going through my own loss, it has made me see compassion in ways that I didn't really have to think about for a while personally, what was I going to say? I'm losing my train of thought here.
Okay. I was actually gonna say that, what was interesting about Bryson, was at the funeral, Amanda was standing at the podium. There were a lot of people there. There's always, it always feels like there's a lot of people when it's a funeral for a child. And we had a bunch of, we had our group from the hospital, and Amanda said, she was going over the groups of people, and she was like, could his like doctors and nurses, his medical team, I can't remember what she said, people from the hospital stand up. And she was trying to recognize all these different groups. And so we stood up, and it occurred to me that we were like, 10% of the people in that room. Because then she's like, next was like, can his baseball team stand up? Can his Cub Scout group stand up? And it's funny because we only know them as patients. We only see them when they're sick enough to be in the hospital. And that was a moment for me, because it shows you that we're fighting for something here that's more than what we're able to see, that we're fighting to let them live the life that we don't even know about. And it was cool to see that, because, it can feel futile sometimes. It can feel like you just don't have any ability to fix anything, but then I looked back on the times where we were able to discharge him, or any of these kinds of patients, and help him in some small way to live the life with all of those other people that were involved in it. And I think that's something that's worth remembering as well, as we kind of move forward through this, that we're not just trying to help them get home to stay in a hospital bed in their bedroom. We're trying to help them live the life, whatever life that is for them, whatever quality of life we can get them. That's what we're really fighting for.
Mm-hmm. Mm-hmm. So that they can have all that other time and all those other things.
Yeah. I always tell people, I didn't realize when I became a pediatrician that basically most kids were going to see me and just cry, because, we get into a thing, we're going to help kids, and most of them do not want you around. They don't want to see you. You sort of get used to that, but that's really our job, is to be there, when they need us, and then just get the hell out of there when they don't.
Yeah. Yeah. I was thinking about when just not losing your humanity. That's the point that I wanted to make too, is that I have a good friend whose son died of a complex cardiac condition as an infant. And of course, he was in the peds ICU at the University of Michigan for quite some time. And they went back on what should have been his first birthday to visit the staff there. And they saw one of the pediatric cardiology fellows that had taken care of him forever. And she started to tear up. And she said, she saw her and she said, I'm so sorry. I'm so sorry. I told myself I wouldn't cry. And for that mom, it was the most beautiful thing in the world to see her cry. Because that meant to her was that her son mattered. her son mattered and that she felt that as a person and that she missed them and that seeing that mom brought something out in her. And so I just think that's a beautiful thing to remember, to not lose your humanity in all of this, and that showing a little bit of emotion is not always a bad thing. That we're kind of don't do it, don't do it, don't do it. But sometimes a little bit is okay. I think not to fall apart so that poor family is having to console you, for goodness sake, but a little bit of humanity is nice.
I think you're right. I'm thinking of a patient recently. It was, I don't know, it was 1 a.m. or something, and I had gotten called in. I was just sitting on the floor of their room, just talking to them, and it was another patient. I didn't have anything. I couldn't fix anything. Like there was nothing I could do there except sit there and say hardly any words, which for me is difficult because I talk, but just sit there on the floor of a room and just be there, and just be there while all the other stuff is going on. And I hope that mattered to her, that she realized in those moments when she looks back on that people were there, and that the whole thing mattered to us, that we weren't just phoning it in, even though there wasn't really anything we could do in that moment, that she recognized that we're just there.
We're there. We're there with you. Yep. Yep.
I gave a talk at a memorial once for some of the patients. And one of the lines, I don't know where I got it from, but it's like, these tiny fingers are incredibly strong, and they sort of grab you and they don't let go. And, you really have to, it is a fine line between letting them affect you and not letting all of that break you when you see the bad things that happen.
Yes,
I think there is that balance between burnout, and then you kind of go the other way and you end up sort of this, cold kind of calculating physician. And so, yeah, there's always that balance is really tough. And I have gone on both sides of it. Like I've been far too much on the, like, I go home and I'm just, sad and kind of broken up about things that are happening. And my wife, who was a child life specialist, who actually went into rooms that were far more difficult than I've ever had to, go into, because she used to go in very specific moments, would say, like, what, just like, let it go. Like, when you're home, it's okay to let that part of it go. And then you're better tomorrow when you go back in. And I always respected her because she could go in and be the most compassionate person in the world. But then we'd get home, or we'd walk home from the hospital, and she would be like ready to have dinner. And I would be like, can I just talk about what happened today?
Yeah.
And so you have to find
you have to find what's right for you, actually. And you're right. It's not the same for every person either. But if you can take some time away and let others care for you in the ways that you need to be cared for, that's helpful as well.
Yeah. Yeah, for sure. She's actually, she always did child life, and then realized that, why doesn't this exist for adults? Like, why is it only kids? And a child life specialist, for anybody who doesn't know, like, their job is to make life as easy and as normal as possible while they're in the hospital. So they do a lot of developmental stuff. They'll help with procedures when there's painful things going on. They make kids laugh and they entertain them. And she's always like, why do this exist here? But like, adults just have to, like, sit in a room all day and not have anything. She built her own health coaching business for that exact reason, that she wanted to help adults, in the same way that kids who are, need help.
Yeah. I know our child life specialist, my foster son had a kidney transplant. So he's been in the hospital quite a bit, at the Children's Hospital, and they gave him Nerf guns. And so you were talking about the Nerf guns. My foster son used to fire Nerf guns at physicians and nurses constantly. They would be, coming in the room, and there'd be a Nerf gun bullet coming straight towards them. So, and it does, you get so bored. It's nice to have a little bit of something to do. And if it's just waiting for your nephrologist to come through that door so you can fire a bullet at him, go for it.
Yep. That's literally what they do. You think about it, they have all day to plan this stuff.
Yeah.
And it usually works.
I know. I think one of the times my foster son was a planned admission, and the nursing staff was waiting in the room with Nerf guns. So when he came around the corner, they fired at him to get back at him. So it was great. Well, thank you so much for just sharing with us a little bit and getting your perspective on Bryson and just life kind of as a doctor taking care of these tough kids.
Yeah, sorry, that's just kind of like my monologue on
No,
on complex medicine in the hospital,
I love
especially
it.
for kids.
I love it. I love it. Thank you so much.
No problem.